Thanks for tuning back in. I just wanted to do a video on our presentation on stuttering. So stuttering is more common than we think, and more than 70 million people in the world stutter. There is no one cause for stuttering. There are some possible causes, which are family history. So if you have one person in your family that stutters, there may be others. There may be small differences in the way the brain works with speech. There are different ways to help children and adults who stutter. And the way that a treatment plan is designed, or the way that you help these individuals who stutter, depends on their overall speech and language skills, how often they stutter, how they react when they stutter, and how the stuttering impacts their daily life, and then also how others react when they stutter. So when you are 2 to 6, your therapy will typically focus on direct strategies to help change the way that you speak. Indirect strategies, so finding ways to make it easier for a kiddo to talk. You may be modeling speech that is slower and might pause more when you're speaking, and then you also may ask fewer questions. Trying to answer questions may lead to stuttering. And then for older children and adults, treatment focuses on managing stuttering to reduce the severity of it and the impact that it has on their lives. Another thing that we do as speech and language pathologists with older children or adults is to help them feel less tense, and also to help them to try to avoidance of talking, so shutting down. Some people, or most people who stutter, can actually predict when they're about to stutter. And when they are able to predict when they're about to stutter, they might change the word that they are going to say to a word that's easier for them to say that they typically don't stutter on. They may stop mid-stutter, or they may avoid speaking when they sense that they're about to stutter. People do this in order to hide stuttering. And there's a specific term for that. It's called covert stuttering. This is a really great age of information slide that was made by ASHA, American Speech and Language Hearing Association. So it gives typical disfluencies, and then stuttering types of disfluencies. Typical disfluencies is the same thing as saying a typical stutter. So some people add a sound or a word, and this is called an interjection, like if we all say once in a while, but if it's frequent, this is considered a type of disfluency. I need to go to work. Also repeating words with more than one syllable. So for the example they give here is my puppy, puppy, puppy. And then repeating phrases is he is 4 years old. Changing the words in a sentence could be I lost my tooth. So that's another one. And then not finishing a thought. His name is, and then just saying I can't remember instead of attempting the word or the name. The types of stuttering that you may hear are part word repetitions. I want a drink. One syllable word repetitions. Go away. Prolonged sound. So this one, the S is prolonged. Sam is nice. And then we have something called blocks or stops. So these are where there's long pauses. So come here. When they produce blocks or stops, this is where you may see a lot of facial tension, really trying to get the word out. This just gives you some suggestions on how to communicate with people who stutter. So one is being patient, giving them extra time to get the words out. And then another one is don't speak for the person. So when someone is stuttering and you're talking to them, let them finish. Don't assume that you know what they're going to say and then fill in what you think they're going to say. Just give them the respect of time and allowing them to finish or complete their own thoughts and their own sentences. Be kind. Bullying is something that children who stutter and even adults who stutter come across frequently. So just remember to be kind. Be aware of your body language, so try to keep eye contact. When someone stutters, don't look away because you feel awkward or anything. Just really try to use appropriate eye contact and communicate just the way you would communicate with someone who's not stuttering as they're speaking with you. And then educate yourself. American Speech Language Hearing Association has amazing resources on stuttering. This is another one that they have. Just gives you information on when to get help for your child. The ASHA Digital Toolkit Stuttering 101 is where I got a lot of this information. I highly suggest you can just put in the web search ASHA Digital Toolkit Stuttering.101 and it will bring you right to the page, and it has information for parents, it has information for family members, or just anyone in general. And then the Stuttering Foundation also has a lot of great resources. They have videos for kids that they can watch the videos. Some of the videos have kids that stutter talking about stuttering. I hope this is helpful. I will try to do some more videos on stuttering.